And a happy Monday to everyone. Thanks so much for joining us on this press briefing. Today, Orange County Mayor Jerry L. Demings will discuss our goals for the week, vaccination centers and testing locations, and an announcement on the Orange County Convention Center site. Mayor Demings will also discuss our emergency rental assistance program that helps our residents who have or are facing evictions, and he will report specific dollar amounts for those who are in need. Orlando Mayor Buddy Dyer is here. He will discuss vaccination opportunities in the city of Orlando and mental health. Epidemiologist Alvina Chu from the Florida Department of Health in Orange County is also here to discuss vaccinations and testing from the state level. We begin today with Mayor Demings. Mayor?
All right, good afternoon to all of you. Hopefully to the ladies and others here in the audience, you had a good Mother's Day weekend. I had the opportunity to spend some time with my wife on Mother's Day, but unfortunately my mother passed about 4.5 years ago. But we do celebrate her, even though she is no longer with us. So to all of the ladies and mothers, I hope you enjoyed your weekend. So with that, we got a lot to cover today. I'll start by just giving you an update. The latest figures show that we now are nearly at 47% of Orange County residents ages 16 and older who have had at least one dose of the vaccine. The Department of Health reports that number as 46.98%. So I'm saying it's 47%. I want you to remember that we should reach 50% later this week, which will allow our community to transition to phase 2. Recall that we will not be required to wear facial coverings outdoors at that level. We do remain committed to reaching the 70% threshold of those 16 plus receiving at least one dose of the vaccine before we can safely remove masks indoors. That 70% is still a stretch goal for us. It's going to take a while for us to get to the 70% at the current rate of vaccinations occurring within our community. So here are the goals for this week. We always start the week by telling you what it is that we hope to accomplish. Number one, we will continue to offer free COVID-19 vaccinations at 5 permanent locations and are promoting our mobile vaccination trailer for businesses or organizations that request it. Number two, we will continue to offer free COVID testing to anyone who needs it, and I'll talk more about the testing. And number three, we will continue to offer a financial relief program that helps our residents and their landlords avoid eviction proceedings. Over the last weekend, our 4 recreation centers, also known as Magic Gyms, were open over the weekend. 604 doses of the Pfizer vaccine were administered. The sites are closed today. Remember, they are closed on Mondays, but you can walk up on Tuesday through Thursday from 9 a.m. to 7 p.m. Then on Friday through Sunday, the gyms are open between the hours of 9 a.m. and 5 p.m. The recreation centers are off of Goldenrod, Meadowwoods, South Econ, and the West Orange gymnasiums. Orange County's Barnett Park drive-through COVID vaccination site has done nearly 500 vaccinations over the past 3 days and continues to gain in popularity. No appointments are necessary at the Barnett Park location. In addition, starting 1 week from today, next Monday, May the 17th through May the 20th, Orange County Health Services will offer COVID-19 vaccination appointments at Barber Park, which is located at 3701 Gatlin Avenue in East Orange County. We will be offering vaccinations between the hours of 9 a.m. and 5:30 p.m. Appointments are preferred, but walk-ups are also welcome. This will be a drive-through vaccination site. You can make an appointment starting today at 5 p.m. at ocfl.net/vaccine, or find out about other opportunities as well from our website. All of these sites are offering Pfizer brand, so all those 16 and up qualify. Minors must have parental consent and have a parent or legal guardian with them at the time of vaccination. Again, the site is ocfl.net/vaccine. Now I'm going to talk a little bit about testing. Barnett Park remains a very busy place for testing. Over the past 3 days, nearly 2,500 tests were administered at Barnett Park, 2,470 to be exact. The site is open 7 days a week between the hours of 9 a.m. to 5 p.m. You do not need an appointment to get a free test at Barnett Park. Within the last hour, the Florida Department of Emergency Management informed our Orange County Emergency Operations Center that the Orange County Convention Center regional testing site will close on Sunday, May the 16th, 2021. So this coming Sunday will be the last opportunity that any of our residents in the area will have the opportunity to get a free test at the Orange County Convention Center. In other words, the COVID-19 testing will transition to local responsibility. The state has not defined any additional testing outreach that will be done by the state here in the area. Since the start of the pandemic, there have been a reported 139,136 positive COVID-19 cases in Orange County. 1,273 of our residents have died from the coronavirus. There's good news in knowing that the 14-day positivity rate is really looking good. It is now 6.1%. Just 2.5 weeks ago, during the week of April 22nd, the 14-day positive rate was 8%. Remember, our epidemiologists and the Department of Health and others have indicated that a community has successfully contained the virus when it reaches 5% or below. Today, our 14-day positivity rate, again, is 6.1%. So I continue to appeal to our neighbors, friends, and others in our community. Let's get vaccinated. We want to get out of this pandemic once and for all. Other news to report. Orange County's Emergency Rental Assistance Program continues to assist residents in need who are past due in rent as a result of financial hardships caused by COVID-19. The program offers up to $10,000 in relief for residents with past due rent who are facing the possibility of eviction. Currently, more than $1.2 million have been distributed to keep families in their homes. Residents living in unincorporated Orange County, plus Apopka, Bay Lake, Belle Isle, Edenville, Edgewood, Lake Buena Vista, Maitland, Oakland, Ocoee, Windermere, Winter Garden, and Winter Park are eligible for the county's program. If you live within the corporate limits of the City of Orlando, the City of Orlando will be administering their program. Mayor Dyer will talk more about that in just a few moments. And the last thing that I will tell you is that Friday we were notified by the federal government that Orange County will be the recipient of an additional $39 million approximately in additional emergency rental assistance funding. Remember that we had received $33 million previously. and we're administering those funds. So they issued what they're calling the Emergency Rental Assistance Program 2. We will be making announcements soon about how we will allocate those additional dollars once received as well. So with that, I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings. The City of Orlando is continuing to work with the Florida Division of Emergency Management to bring mobile vaccine sites to residents close to where they live. So Tuesday and Wednesday, there will be a mobile site at the Link Central Station. Sunday, there will be, again, a mobile site at the Lake Eola Farmers Market. Every Wednesday, beginning this week, the I Got My Shot mobile trailer will be at Lake Eola from 9 a.m. to 11:30 a.m. right off of Roslyn and East Washington Street, right near the Disney bandshell. Thursday, there'll be, through a partnership with the Magic and Advent Health, there'll be a community vaccine site hosted at the Amway Center. This one does require an appointment, so to make an appointment, visit adventhealth.com/Orlando Magic Vaccine. That's adventhealth.com/Orlando Magic Vaccine. I've had the opportunity over the last several weeks to visit a number of the mobile sites, and I continue to be impressed with how quickly and efficiently they can get vaccines done. So any of these walk-up sites, you can get there and be done in about 30 minutes, and that's inclusive of the 15 minutes that you need to wait after having had the vaccine administered. So knowing that you can take 30 minutes out of your day to protect yourself and protect your family, I think that's a very wise investment. I know this last weekend was Mother's Day, and it was certainly a little bit better than it was the year before. I had the opportunity to celebrate and honor my mother and my wife, Susie. And it's critical that we continue to protect our moms, and the best way to protect your mom is to get vaccinated. As we're there for our moms, it's also important that we check in on ourselves. May is Mental Health Awareness Month. Keeping yourself healthy, both physically and mentally, during this pandemic is so important. There's probably as many or more issues related to mental health right now as there are with the physical health. If you need to talk to somebody, you can reach out to Heart of Florida United Way's 211 service, and they'll connect you with support services to meet your needs. And lastly, I can't say enough about how proud I am of our community, not only for getting vaccinated and doing the right pandemic procedures, but also continuing to support Orlando's small businesses. Last week was National Small Business Week, and I had the opportunity to visit a number of businesses. Orchid Cleaners, one of the many Asian-owned businesses on the Mills 50 district. Perlo's Pizza, where you can get a pepperoni and banana pizza, which is quite good, actually. CC Community Pharmacy on the west side. And these small businesses make our community vibrant and create economic opportunities. And the most important thing is the money that you spend with a small business stays in our community and recirculates. So thank you for supporting those small businesses. Ms. Chu?
Thank you. As Mayor Demings had mentioned, as of today, Orange County has reported 139,136 positive cases. Our recovery rate remains at 97%. And our 14-day rolling percent positivity rate, we are encouraged to see that it's gone down to 6.1% and was previously 6.9% the last time we spoke. Unfortunately, we've had 1,273 deaths reported to us. The dashboard on the state site has reported 1,275. 2 of those deaths were transferred out of our jurisdiction, 1 to Seminole and 1 out of country. Unfortunately, these deaths, since the last time we spoke, the age range was 40 to 90 years old, and the median age for these newest deaths was 54 years old. To the families and friends, we want to express our deepest condolences during this difficult time. 3 of the deaths recently were female, 5 were in males, 2 were Black, 6 were white, 3 were Hispanic, and 5 were non-Hispanic. All eight of these had known underlying health conditions. 5 of the dates of death are from April, 2 of the dates of death are from May, and 1 date of death was from August 2020. 2 were reported with a long-term care facility address. As of today, we've had a total of 575 variant cases reported to us since the last time we spoke. 24 of these were of the B117 UK variant, which is now a total of 508 of this type of variant reported to us in Orange County residents. There were no additional deaths identified with variant cases since the last time we spoke. 201 had no known hospitalization, 35%. 5 did have a known hospitalization. 197 had no known travel, which is about 34%, and 13 did have known travel. So as you can see, the majority of these have no known travel history. For breakthrough cases, we've had a total of 236 breakthrough cases reported to us. 78 had symptoms, 60 had no symptoms, and 98, the symptoms are unknown. So of those where we have information, a little over half, or about 56%, did have some new symptoms for these breakthrough cases. The age ranges for these are 18 to 99, with the median age years. 67% were female, and 33% are male. So as we continue to vaccinate our community, increase the immunity that we have here, we'd like to encourage everyone to continue the pandemic precautions. So it's not just one tool in the toolbox, we're going to use all the tools to help us decrease transmission. And so we continue to encourage people to avoid large gatherings, whether indoors or outdoors, wear your mask to contain respiratory droplets, also watching your distance to decrease transmission, and making sure you wash your hands well with soap and water. And especially important is if you experience symptoms that are consistent with COVID, stay home if you are sick, and we encourage you to get a test to find out if you have COVID, and we encourage those who are your close contacts to get a test after exposure to identify whether they may also be infected with COVID, so that they as well can stay home, whether they are sick or not. And so we encourage persons who are known to have an exposure to stay at home and quarantine. 14 days is best if there are some options, and most people take the 10-day option, which is with no test, but 14 days is the general maximum incubation period, so after an exposure. For vaccinations, the total doses administered in Orange County for all sites is 983,772, and that's an increase over the previous day of 2,007. Orange County residents who are 65 plus with the completed vaccine series, we have 118,174, and that is an encouraging 73.25%. So those who are the most vulnerable in our population, we've done a really great job at vaccinating them, and we've seen a concurrent decrease in hospitalizations and deaths in this population. And so we continue to encourage everyone who is eligible to get the vaccine so that we can as well see this decrease in severe hospitalizations and deaths, and also a decrease in transmission so that we can get back to our new normal or pre-pandemic times. For residents 16 and plus receiving 1 or more doses of vaccine, which this also includes the Janssen vaccine, as Mayor Demings had mentioned, is 550,948, which is 46.98, or very nearly 47%. And so on our way to moving over to phase 2, while continuing to adhere, or at least recognize our pandemic precautions, help reduce transmission while we work towards this goal. With that, I'll take any questions, and I'll turn it back over to Mayor Demings. Thank you.
All right, thank you, Ms. Chu. At this time, we'll open up for any questions, but we are joined today by several of our commissioners. We have Orange County Commissioner Nicole Wilson, Orange County Commissioner Myra Uribe, and Orange County Commissioner Maribel Gomez Cordero. In addition, we have from the school district, Mr. Scott Howard, and we have our Director of Public Safety, Director Banks, who have joined us today. And with that, we'll open it up for any questions that you may have, and we have Ms. Lauren Seabrooks first.
Thanks, Mayor. Lauren Seabrook, Channel 9. Alvina, my question's for you. I'm curious, with our 14-day rolling positivity rate dropping at what seems to be quicker than I think expected, if we do get to that 5% where we can drop the mask, can you give us some perspective maybe on where we'll be at? Because I think so many people worry that we're not at herd immunity until we get over 70% vaccinated, but why would it be okay for us to go ahead and drop the mask and be in a good place if we were at 5% positivity rate?
Right, so herd immunity, I think we had talked about, is not a magic number or threshold where once you cross it, something magical happens and there's no more transmission. So we're working towards reducing new infections, and so the percent positivity is one indication of the amount of transmission that is occurring in our community. So while we increase the immunity in our community, we can decrease transmission at the same time. Are not mutually exclusive things, and so we want to use all the tools in the toolbox to help flatten the curve and decrease the transmission. So if we don't magically reach 70%, we can still, if we decrease transmission, be able to be relatively comfortable that we have gotten some good handle on it, but we will all need to do all the things together. Thank you.
And the only thing that, Lauren, I will add is we will be looking at a sustained 2-week period of time where it would be 5% or below. And so even if we get to 5%, it has to sustain itself for a couple of weeks. So that still adds additional time to making certain that we are doing things safely within our community. Okay. All right. Other questions?
Yes. Buenas tardes, Alibet Suárez con Telemundo 31. Mi pregunta es para el alcalde Jerry Demings. Se ha eliminado en este momento el requisito de prueba de residencia para recibir la vacuna. ¿Quiere esto decir que un turista que viene a visitar el condado Orange se puede vacunar?
The residency requirement has been dropped for the vaccine. Does that mean that tourists can receive vaccine in Florida?
The answer to that is yes, and they have been receiving the vaccine for some time now, especially since we have federally sponsored sites within Orange County.
La respuesta a la pregunta es sí, y han estado recibiendo la vacuna, especialmente porque tenemos que son patrocinados por el gobierno federal.
Okay, other questions?
Emily Braun, News 13. This is for Mayor Demings. Mayor Demings, do you have a plan in place for vaccination sites, specifically for ages 12 to 15, in anticipation of Pfizer's emergency authorization for that age expected this week, or for certain sites already existing to accommodate that age group?
Yeah, we're prepared to accommodate the inoculation of persons 12 years of age and older at the regular sites that we have. Much like parents who have to bring the children or be present when children 16 and 17 are vaccinated, the same will go for those 12 and above. So we're prepared to do all of that. Okay.
Right here. This is Melissa Thomas with Florida National News. So my question is with regards to the rental assistance. So I wanted to find out, have you, over the course of the year during the pandemic, have you seen an increase or decrease in the number of requests that you guys have had? And now that there is an increase in money coming, were there any changes that you needed to make to the system? Were there some common pain points that you guys heard that you made changes for?
The existing rental assistance program has certain mandated federal guidelines in order to be eligible for receipt. Primarily, the existing rental assistance program is aimed at reimbursing landlords. However, the tenant and the landlord have to agree that the individual would avoid eviction and remain in their home. Under that particular program, the renters are eligible for up to $10,000 in assistance, but the check is cut and paid directly to the landlord. It's my understanding with the new rental assistance program, there may be an opportunity for direct payments to the renter. We're exploring the different nuances associated with that. We will be exploring the potential for expending dollars to be used in transitional housing for individuals who may be homeless and mentally ill, who may need some transitional housing. So we'll be exploring all of that under the new program. So between the 33 million and the nearly 39 million, that's $72 million that will be available. That's good news for our community. But we will be further defining the plan, the spending plan that will be presented to the Board of County Commission, and ultimately we look to the board to approve that expenditure plan that will give us the type of flexibility to reach the greatest number of persons in need in our community. It could be individuals and families. Okay.
Nikki Zizaza with News 6. This question is for Mayor Demings. Mayor Demings, it looks like we are inching closer to phase 2, and following the governor's announcement to suspend local COVID emergency orders, have you noticed a shift here in the county in terms of just the conflicting messages from the governor and here locally? Are people complying with what we have in place here locally, or what's that change, if any?
What I don't see is widespread non-adherence to the guidelines that we established here within Orange County. Those guidelines were developed with an abundance of input from the experts here in our community. And from my eyes, I see the overwhelming majority of people in this community still following those guidelines because that's what they feel comfortable doing. They have confidence in the direction that's been given, and in terms of re-engaging without masks within our community, we still see a significant number of people who are not yet ready to do that. So we had a very measured approach that was recommended. We admittedly understood that we would see a tapering off of individuals who would get vaccinated within our community. That is something that we are experiencing all over America. And there are various reasons for that in terms of the hesitancy to get vaccinated. But it is but one measure that we look at to measure whether or not we are controlling the virus within our community. We look at the positivity rate. We look at the testing to be able to tell people what their current status is. And all of that is playing well for me within this community. Now, for those of you in the media, I know that I see your news trucks moving throughout our community, and you probably have formulated your own opinion about whether or not people are following the guidelines that were being recommended by the Centers for Disease Control. The phasing approach that was recommended a couple of weeks ago now was, in my humble opinion, a sensible approach to give guidance to our public so that they could understand what to expect and when we could do certain things. So I'm confident that the community is going to do the right thing. People are still afraid to contract the virus or spread it unknowingly. That's why we really see testing remaining significant at our Barnett Park location primarily. So that's the feedback I would give you at this point. To the media, do you all see a lot of people not wearing I see everybody in here wearing facial coverings, and do you see a large number of people in our community who are not wearing facial coverings? Okay, and so some people say yes, some say no. So I think over time, this is why I'm a bit of a realist, that the further we go, the more difficult or more challenging it is going to be to continue wearing facial coverings. But that doesn't stop us from giving the guidance that is needed in our community. Okay, other questions?
Matt Lapoli from WESH. My question is for Ms. Chu. I was curious about the variants and the mutations. Has there been any change in what percentage of the tests that come back are then tested for the variants, or is it still a rather small percentage? And could you put that into context for us?
I haven't looked recently, I would just say. So it is available, that number is available on the CDC website as part of the national testing program, and so you could identify that for the state of Florida. I don't specifically know what they are in Orange County since we don't do the lab testing here ourselves. The intent for the program itself was to increase the percentage of specimens that were tested so that we could continue to conduct virologic surveillance to identify any increase in the numbers and also to identify any new variants. So, but that is, again, the references on CDC, which I can certainly send you.
Steve Hudak from the Orlando Sentinel. I'm curious, Mr. Mayor, our testing numbers, or our testing sites end on the 31st of May, right? And so
not all of them. We will reevaluate. We will continue to do some testing here. We'll continue to offer free testing. So I don't want you to think that there won't be any testing available, free testing. There will be. The convention center, as I shared with you, the state has made a decision that it will be closing its regional testing sites, Sunday.
I was getting to my question.
Okay.
The setup, but I appreciate that because that was a big part of it. The other thing is, with the vaccination numbers still stagnating or slow, is there anything else we can do? I mean, even the Magic Gyms where we had, 600 over the weekend, but each one of those have the ability to do 1,000 a day, right?
Yes, and keep in mind this was Mother's Day weekend, and it may have played a role in seeing the numbers drop off. I don't know that to be certain, but we're being creative, and thankfully we have organizations like the Orlando Magic that's stepping up to the table and being creative. We will be looking at different employment centers and partnering with them if we can get a significant number of employees at various employment centers who want to get vaccinated. There'll be partnerships there. We are certainly partnering with various community-based organizations. We are using the I Got My Shot campaign and other campaigns to try to encourage people to get vaccinated. We have even looked at the age demographics. You probably see some of the public relations campaigns aimed at seniors, and then there's some aimed at those who are middle-aged, and then there's some aimed at a younger demographic. But let's say if the CDC and the Food and Drug Administration approve the temporary use of vaccine for children 12 and older, that will add another demographic to the mix. And right now in these multi-generational households, those who are 12 to 15 cannot currently get vaccinated. And so for some parents, they may have children who fit within that age group. And so I think that if that does happen, we'll see a little bit of a bump in the number of people who want to get vaccinated. As we near the end of a public school year, we know that our children some are going to be playing catch up. Orange County Public Schools, I know, is offering summer education programs, and We plan to partner with them and continue. Scott, I don't know if there's anything you want to come up and share about some of the outreach efforts planned with the schools or not. He's moving this way, so I'm going to assume that's a yes.
Yes, and the mayor said we are working on additional vaccination sites. We have one going on today for 16 and up at Wekiva High School. One will be Wednesday, East River, for 16 and up, and those in the community that want to walk up. We're also poised and ready to work with the county and with Florida Department of Health in Orange County to do vaccination sites in other locations. As they move down into the 12 and up range, we're certainly willing to open up our school facilities to help ensure that not just the children, but the community surrounding those facilities also have access. So we'll do and have done whatever we need to do to help make sure we get the word out and get as many individuals vaccinated that want to be vaccinated in our schools. So.
This next question comes in from Alexa Lorenzo at Channel 9. Her question is for Mayor Demings. Mayor Demings, OIA was the third busiest airport in the country this weekend. What does that tell you about our travel and economic rebound? Are you anticipating this is just the beginning as summer travel approaches?
We have had sustained high numbers of travelers coming into the Orlando International Airport based upon TSA count for several months now. And we believe that it will only get better as we move into the summer months. A number of conventions have rebooked here. You heard that at the last press briefing, but we also believe that the leisure business will return. Visit Orlando did their projections a week or so ago, and from their projections, based on hotel bookings, we should see our tourism numbers begin to rebound very well. The controller, Phil Diamond, gave you an indication of where we are with our tourist development tax receipts. They're up. So in terms of our economic recovery, we're well on our way to recovering. In June, I'll be doing the state of the county. I believe that there will be good news June the 4th. We'll be doing the state of the county, and I'll do a comprehensive review and update at that point.
Thank you. This last question comes from Ryan Lynch in the Orlando Business Journal for Mayor Demings. Mayor Demings, since Governor DeSantis' order regarding local emergency order went into effect, have you seen an increase or decrease in complaints when it comes to businesses following pandemic guidelines?
We get a fair number of complaints that continue to roll in through various ways into the county about businesses that are no longer requiring facial coverings or do not have adequate social distancing based upon the consumer confidence. Yes, the numbers have gone up, I think, slightly in that regard. But I'm happy to say that we had driven this to 99% plus compliance, and the overwhelming number of businesses continue to follow those guidelines. Our theme parks are continuing to follow the guidelines that were suggested, and we appreciate their efforts. Okay, with that, if there are no other questions, then we'll conclude this press briefing. The next press briefing will be on Thursday, Friday at 4:30. Friday at 4:30. So we hope to see you Friday at 4:30. Thank you all for being here. And remember those commissioners over there if you have any tough questions for them.